Good evening, wherever you are. This is Benji Cross from ConferenceHype. Our segment will focus on follicular lymphoma transformation is characterized by cytokine-associated remodeling of stromal and macrophage compartments. From the 2026 August 3 edition of Cancer Discovery. Background: UNLABLLED. Although epidermal growth factor receptor fusions in non-small cell lung cancer typically show sensitivity to tyrosine kinase inhibitors, we identified an EGFR SHC1 fusion subtype that exhibits intrinsic resistance to EGFR TKI monotherapy through a dual activation mechanism in the preclinical and clinical settings. Methods: EGFR SHC1 fusion protein comprises of N-terminal EGFR and C-terminal SHC1. Results: we demonstrated that EGFR SHC1 simultaneously activates the EGFR kinase domain and SRC-mediated phosphorylation of the SHC1 fusion partner, thereby driving ERK-AKT pathway activation and tumorigenesis independent of KD inhibition. Discussion: see related commentary by Ler and Wolf, p. From the 2026 August 3 edition of Cancer Discovery. Background: UNLABLLED. Lymph node metastasis in early-stage pancreatic ductal adenocarcinoma predicts systemic dissemination and poor survival, yet its underlying mechanisms remain elusive. Methods: in this study, we demonstrated that senescent cancer-associated fibroblasts drive lymphatic remodeling and LNM in early-stage PDAC. Results: mechanistically, SENCAFs increased glucose metabolism and lactate production, which activated lactylation-mediated serine metabolism to protect lymphatic endothelial cells from oxidative stress. Discussion: significance. Our findings have revealed a closed link between cellular senescence, metabolic reprogramming, and spatial immunosuppressive niche and PDAC metastasis, offering the potential senolytic drugs to improve chemoimmunotherapy efficacy in patients with PDAC. From the 2026 July 27 edition of Cancer Discovery. Background: small molecules that modulate protein complexes have transformed cell biology and oncology, yet few chemical starting points exist to probe protein-protein interactions. Methods: to expand this space, we developed molecular coupe LRS, elaborated small molecules flanked by two cysteine reactive warheads. Results: using Connect, an integrated chemical proteomic platform that identifies proteins and complexes amenable to coupling, we revealed 171 targetable protein classes, including mutant-selective complexes and assemblies not traditionally addressed by small molecules. Discussion: overall, molecular coupe LRS offer an unbiased framework to discover, characterize, and pharmacologically exploit protein complexes. From the 2026 August 3 edition of Cancer Discovery. Background: UNLABLLED. Intratumor heterogeneity for human epidermal growth factor receptor 2 in HER2 positive breast cancer is a driver of resistance to HER2 targeted therapies. Methods: the advancement of treatments for HER2 heterogeneous tumors has been hindered by the lack of preclinical models that accurately mimic the human disease. Results: our results elucidate the functional relevance of HER2 heterogeneity and propose improved therapies for these tumors. Discussion: we identified novel therapeutic strategies to sensitize HER2-low cells to TDXD, providing mechanistic insight and offering promising avenues to overcome resistance and improve patient outcomes. From the 2026 August 3 edition of Cancer Discovery. Background: UNLABLLED. diffuse large B-cell lymphomas are genetically and phenotypically heterogeneous, making diagnosis and treatment challenging. Methods. Current models suggest DLBCLs derive from follicular B cells engaged in adaptive immune responses. Results. This trajectory is associated with sex-biased outcomes. Female patients and mice exhibit reduced survival compared with males in our cohorts. Discussion. Significance. The findings in this article support a distinct developmental origin for BN2 DLBCL and identify a high-risk female population with actionable targets for precision therapy. From the 2026 August 3 edition of Cancer Discovery. Background. UNLABLLED. Childhood cancer survivors have a heightened risk of developing subsequent neoplasms related to therapy. Methods. We analyzed whole genome, exome, and RNA sequencing of 200 breast, meningioma, and thyroid SNs, which developed a median of 26.4 years after childhood cancer among 160 survivors. Results. We analyzed whole genome, exome, and RNA sequencing of 200 breast, meningioma, and thyroid SNs, which developed a median of 26.4 years after childhood cancer among 160 survivors. Discussion. See related commentary by Bertrams and Van Boxtel, p. From the 2026 August 3 edition of Cancer Discovery. Background. UNLABLLED. DNA mismatch repair detects and corrects post-replicative DNA alterations. It is deregulated in up to 20% of human cancers. Methods. MMR-deficient cancers display increased tumor mutational burden and microsatellite instability, and are eligible for checkpoint inhibitor immunotherapy, which commonly elicits durable responses. Results. MMR-deficient cancers display increased tumor mutational burden and microsatellite instability, and are eligible for checkpoint inhibitor immunotherapy, which commonly elicits durable responses. Discussion. See related commentary by Bernards, p. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 July 23 edition of Cancer Discovery. Timothy Yap, MBBS, PhD, Vice President and Head of Clinical Development in the Therapeutics Discovery Division and Professor in the Department of Investigational Cancer Therapeutics at the University of Texas MD Anderson Cancer Center in Houston, spoke with Cancer Discoveries, Susan Rose about how clinical trials have evolved, the role of AI, and the challenges facing today's drug developers. His research focuses on the first-in-human and combinatorial development of molecularly targeted agents, immunotherapies, antibody-drug conjugates, and radioconjugates. From the 2026 August 3 edition of Cancer Discovery. Background. UNLABLLED. Transposable elements, mobile DNA sequences that can move independently about the genome, make up about half of the human genome, and are mostly silenced by epigenetic modifications in healthy differentiated cells. Methods. Global epigenetic dysregulation during oncogenic transformation causes TE expression, contributing to transcriptional rewiring and TE activity as insertional mutagens. Results. Significance. Ts are expressed at significantly higher levels in cancer cells compared with normal cells as a consequence of epigenetic dysregulation. Discussion. See related commentary by Sun and Greenbaum, p. From the 2026 August 3 edition of Cancer Discovery. Background. UNLABLLED, spatial transcriptomics and proteomics have enabled profound insights into tissue organization. Yet these technologies remain largely disparate, and emerging same-slide multiomics approaches are limited in plex, spatial resolution, signal retention, and integrative analytics. Methods. We introduce in situ de-edled phenotyping to high-resolution transcriptomics, a streamlined, resource-efficient, commercially compatible workflow using single-cell spatial proteomics-derived imaging to guide transcriptomic capture on the same slide without RNA signal loss. Results. To integrate modalities beyond niche-level mapping, we developed spectral graph cross-correlation, a proteomic transcriptomic framework resolving spatially coordinated functional state changes across interacting cell populations. Discussion. Coupled with SGCC, it resolves coordinated spatial immune remodeling, revealing EBV LMP1-driven C1q macrophage polarization and CD4 T-cell dysfunction in DLBCL, with broad applicability to other diseases. From the 2026 August 3 edition of Cancer Discovery. Background. UNLABLLED. The added value of comprehensive genomic and transcriptomic profiling with whole exome sequencing and whole transcriptome sequencing as compared with conventional targeted panel-based sequencing is not well characterized for patients with cancer. Methods. We analyzed CGTP data of 99 patients with advanced cancers across 19 solid tumor types and assessed the presence of actionable DNA alterations and RNA expressions linked to approved or investigational agents. Results. We performed WES and WTS for patients who had prior targeted panel sequencing and had no DNA alterations with approved biomarker match therapies. Discussion. Transcriptomic actionability analysis identifies actionable RNA expressions for patients beyond those with actionable DNA alterations, highlighting the potential of transcriptional profiling to enhance therapeutic opportunities in precision oncology. That's it for now for ConferenceHype's coverage of the August 2026 issue of Cancer Discovery. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments. Share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.